hire a TaskRabbit to come in and do your laundry, or have your good friend
I wish we
come
had
do
a
it.
TaskRabbit down, Archie. Hey guys, welcome back to the AA Skin Babes pod. I'm your host, Lena, a licensed esthetician, and with me this week is Heather.
Hi, I'm Heather Taylor, nurse injector.
We also got Kristen.
Hi, I'm Kristen Sanborn, and I am a licensed esthetician.
And back this week, we have Miss Lauren Umstattd with Leawood, and your job title is?
I'm a facial plastic surgeon in part of the greater Kansas City area.
Not just regular plastic surgeon. She's facial plastic surgeon.
Yes.
And you can go back to the last episode to deep dive into what she does. We covered that a little deeper. But this week, we are going to go actually a little bit deeper into the actual procedures. Lauren, I lost my train of thought. Time out. Okay, we're good. Okay, so we want to go more into like the professional side, like your side of this. So how important is it for board certified and credentials? Do you ever I hear these stories about like Mexico, like you go to a different country or you go to someone who's not actually board certified. Does that happen really in real life?
Well, it's a wild world out there. I like to start by saying that there are incredible surgeons everywhere in this world. Right? I just went to Italy for a course and met a bunch of amazing surgeons. So I think it's less about like where you practice and your actual credentials and more about your unique skill set and the attention to detail and the care you take of patients. Now, board certification is actually not that hard to achieve. It's just like you did all the stuff and like did all your paperwork. It doesn't mean you're like a great surgeon. It doesn't mean you're a great communicator. It doesn't mean you're a good team leader. But it is important to make sure that someone is like actually licensed to practice medicine in the state or country that they are practicing in. I think when it comes to like vetting your surgeon, it's good to look up their credentials. As facial plastic surgeons, we usually take one of two routes. Most of us become head and neck surgeons first. So I did a 5-year residency in otolaryngology head and neck surgery, which is a long title, but that's what I'm actually boarded in. So that means we're basically doing all the surgery from like here to here. So hairline to collarbones, whether that's cosmetic stuff, reconstructive stuff. We did a lot of trauma, like facial trauma, a lot of big like skincare, horrible reconstructive stuff, a lot of kids, like ear tubes and tonsils and throat stuff. And then we do a fellowship after that for facial plastic surgery, where we focus on either cosmetic surgery or reconstructive surgery of the face. And then, so that's one group. Most of us come from the head and neck world. And then there is another route to get to facial plastic surgery that's doing a plastic surgery residency, where they're focused on basically the whole body. Mm-hmm. A lot of breast work, abdominal work, hand work. And then they also specialize in facial plastic surgery. So you just, along the way, you just get like more and more niche.
Yeah. Like you just figure it out.
Yeah.
Did you always know that you wanted to focus on the face? Was that kind of your
No, that would be a better story, but no, I mean,
I was going to be like a midwife. That's what I went to nursing school for. And then I was like, ooh.
You watched your first baby born.
Yeah, I was
I've
like,
heard this story. You're like,
hey. I don't think this is for me.
but you still work with a lot of women, which
I do. Right.
Have.
Yeah. 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 So then I went into critical care, but then I was just like, down there is not for me. So yeah.
She don't even let me wax her down there. So
that's because she's scared. And that's because she has a very low pain tolerance.
She's the biggest baby. The biggest baby. All right.
And I had my babies naturally, and I'm still a baby.
You did?
I did. No drugs.
You?
Yes, ma'am. Yes, ma'am.
Out of all
did.
People, Heather
yes,
did
ma'am. I did. Both of them.
Okay. Props to you.
Mm-hmm.
Go you.
Mm-hmm.
But when you wax your legs, you cry.
I didn't cry.
You almost did. You're like, oh.
I just made some noises.
Let's get back on
Said
subject.
Some few choice words.
Okay, so now we've talked about like what to look for, like what don't you want? Like what are some red flags? Like when you're looking for a facial plastic surgeon, what are some red flags?
I mean, I think again, a few pieces of advice here. The first is that you should get multiple opinions. I tell every patient you should have multiple consults. And it's good to think about all of the actual objective things, but then it's also good to get the subjective feel of the office,
Mm-hmm.
your gut feeling with the surgeon. Are they actually listening to your concerns? Are they answering your questions fully? Um, Anywhere from like the very start of the process. So, like when you call into the office, do you actually get a human or do you get a robo message?
Mhm.
Mm-hmm.
Press 1 to talk to a real person.
Yeah, I just think it's such an intimate decision that it's good to know that there's this whole group of humans there that are going to care for you. And most of the time, things go right. But then it's even more important when things go wrong and you need that extra
Mm-hmm.
TLC to get you through complications. And so the surgeon is kind of the one that you're focusing on, but really it's the whole team that orchestrates the entire
Mm-hmm.
pre-op, operative, post-operative processes.
And making sure they're reaching, like, they're there afterwards. Like, if they're not there before, they're not going to be there after.
Yeah, yes. And, as we've grown, like as I've grown busyness wise, we have a nurse practitioner who's amazing. And at first I was like, this is weird to have her like help me with the post-op patients and take stitches out and things like that. But like the patients know that we're a huge team and there's just
Mm-hmm.
constant communication between all of us. So in order to be my best self, I have to have other people there that help me with
Mhm.
patient care.
Okay. And now we're going to go about. So we answered about the whole board certification thing. But what's the difference between a plastic surgeon and then a cosmetic surgeon?
So cosmetic is kind of this loose term that is less descriptive. So if we think about my title, I am technically a facial plastic and reconstructive surgeon. That's a lot. But I focus on cosmetic procedures. So, of all of the things that I could do, I don't like sad stuff like cancer. I don't like scary stuff like trauma. I love cosmetic surgery. So, cosmetic just means that, like, it's not needed,
Mm-hmm.
it's
Mm-hmm.
elective.
Mhm.
And so, you can be a plastic surgeon that focuses on hand surgery, you can be a plastic surgeon that focuses on cosmetic procedures. It's kind of more of a description of your actual practice, less about your credentials.
So it's like a big bubble, and then you got all these little ones, and you are specialized in these.
Mhm.
Yes, and it is difficult and nuanced. So, again, in asking those questions of your surgeon, it's good to be like asking those and then see how they respond and how they
Mm-hmm.
explain
Mm-hmm.
things. You're not asking those to be like offensive or rude. It's like you want to be an informed consumer of your care.
Mhm.
So it's important to ask those questions.
So we want to also walk us through if someone was like, from the moment they call the um clinic to, I want a facelift, and what that all looks like all the way through to post.
And I'll say every office and every surgeon is different.
Mm-hmm.
We're about 3 years into my business. So this is our current thing our current process. So when you call in and inquire or text in
Mm-hmm.
about a facelift, we first have you submit some photos of yourself. And I like to screen those photos to make sure that I feel like anatomically they're an appropriate candidate for the procedures they're interested in. We also have them fill out a medical form to
Mm-hmm.
make sure that I feel as though medically they are okay for considering surgery. So I screen both of those. And then if I say, yeah, I think they're a candidate for a facelift, then we can schedule a consultation where it's a full hour of my time where I sit down with the patient. It's just me and them. And we walk through every component of their anatomy, the procedures I think that would benefit them. We talk about the risks, the downtime.
Mm-hmm.
We look at pictures of other patients that are similar and dissimilar to them so that we can get a sense of maybe what their outcomes are going to be like. I show them these really graphic images of some complications that I've had to say, like,
This can
this
happen.
can happen.
Mm-hmm.
And statistically, the risk of all of these complications is super low, but I've seen every single one of these. And when you operate, 3 days a week for a full year, like, just statistically, it just things add up, right? Um, so timeline-wise, usually when you call in to get a consultation, it's several months because I'm way booked out. So if you're thinking about this, it's important to plan ahead. It's also kind of a good sign if you call an office and a surgeon
Yes,
is
it
booked
is.
Yep.
out a ways.
Yes.
Yeah.
It's also no rush, right? We're not like saving lives, curing cancer here. So it's okay to wait. And I like to take my time with people, so I will not see more people in a day. I would rather have people wait longer, which I know sucks if you're the patient that's interested, but that way I'm able to keep the amount of time and quality with each patient where it is.
Mm-hmm.
Mm-hmm.
So then after the consultation, we as a team, you and me, the patient, we decide, like, do we feel like we want to move forward with scheduling surgery? If so, then they start looking at dates and talking about money. Um, I am like a very frugal person myself, and so I always like to know the cost of something before I'm even going to go look at it. So I'm one of the few surgeons out there that puts all my
Oh, yeah.
prices
I
online.
love that. So
I do
we
too.
can send our
Very
clients to your
transparent.
website and say, look at it.
Yep.
Her price that she put her prices right out there. She has her surgery center in her clinic.
And it's beautiful.
Yes.
Your facility is beautiful.
Thank
State of the
you.
art. It's beautiful.
So yeah, those prices are just that's what it is. There's
Yeah.
no like extra tax or fees or anything. It's just like that's the price. And then it's tricky because we're a growing practice. The price that you see when you book your consultation is the price that we honor. So even if you book your consultation 3 or 4 months from now, we will honor the price that you like kind of agreed to when you even came in for a consultation because I
Yes.
feel like that's fair. And then it's usually a several month wait for surgery as well. Again, I don't like to be rushed. I like to have my attention totally focused on one patient. And so a big case for me is usually 4 or 5, maybe sometimes 6 hours, where I'm doing facelift, neck lift, brow lift, upper and lower blepharoplasty, lasering. And so I only do one of those a day. And again, I'm not willing to do 2 of those a day. I just don't. I don't think my second would be as good as my first.
Yep.
Yes.
But
That's
that
it.
makes you good because you recognize that.
Yeah,
You
and
know?
I'm young, like, I'm in it for the marathon, I don't
Yeah.
wanna burn out.
Yeah.
So then, a month before the surgery, you come back to the office, whether it's virtually or in person. We have an appointment with you and our coordinator where we start crossing our I's, dotting our T's, where we get, like, your pharmacy, your emergency contact, your arrival time. We set some of your post-op visits. We're very, um, detailed with the whole thing. And then surgery day, you're there pretty much all day. You have your cell phone or you have my cell phone number that first 24 hours. I operated today. So I literally have my phone like right here in case they call and need something tonight. And then everybody comes back the next day after surgery so that I can physically look at the human. Like, how are you doing? How are we with pain control? How are we with nausea? Rarely people get into this kind of spiral of like migraine, headache, nausea that we have to kind of give them some extra fluids or whatever. And then for a lot of our traveling patients, I ask them to stay in Kansas City for 10 days before they fly home because the first 10 days are really when little things can pop up, little fluid pockets, little dehiscence of an incision where it separates a little bit. But it's wild right now. Probably 60% of our patients fly into Kansas City,
Wow.
have surgery, and then leave.
Wow.
That's quite a credit for you.
Yeah.
I know. I mean,
Yeah,
that's a
awesome.
pretty awesome thing.
It's awesome, but it's also hard because
Yeah.
I'm like they're like my little chicks in an incubator. So I start to get nervous like right when they leave town. I'm like, oh God, what's gonna happen? Like because
Yeah.
it's really hard to manage stuff when they're away.
Well, and you just worry about like infection and I mean, all of the things. It's like now you're not just going to be home, you're going to be at an airport, on an airplane,
Yeah.
traveling, just all the things. I can see
Yeah.
where that would be. Yeah.
And then, I follow them for months after surgery. Obviously, Kansas City folks are much easier to take care of. And then our traveling patients, we follow up virtually with selfies and videos with me and them. And then usually at like the 3 to 4 to 6 month range is when people are ready to kind of graduate and fly off. There is a small percentage of folks that aren't super satisfied with their results, and so we stay in touch for much longer, and sometimes we plan to do revision surgeries or little tweaks to
Mhm.
things.
Mhm.
So those patients, they're my chick much longer before they fly.
Or she's the
Leave the
mama
coop.
bird that pushes it off the tree. Fly. What are some of the biggest mistakes your patients make, either pre or post surgery?
I think the answer depends on if they're a man or a woman. And don't, I know that's probably not PC these days, but I think in general, males tend to underestimate the recovery process.
Mhm.
Yes.
Even when I tell them, you are going to look horrible for 2 weeks, they come in like 5 days after surgery and they're like, I look horrible. I can't go to play golf today. And
I
I'm like,
told you that.
no.
Yeah.
So I think trying to rush the recovery process and just like assuming you're going to be healed is probably the biggest mistake, right? So, like the first 2 to 3 weeks, just prepare to look like you've been in a horror film, right?
Mhm.
And then if I tell them that, then if it's less than that, it's okay.
Yeah.
Just
Yeah.
It's better to overestimate than underestimate.
Yes, definitely.
yes.
Because patients and clients take your word for
Mhm.
freaking stone.
Yeah.
It's like, okay. It could be 1 week, it could be 2 weeks, it could be 3. You
Yeah.
never know.
And then I think for most women, I'm generalizing here, but most women feel like they got to get up and start doing stuff.
Mhm.
Mm-hmm.
And I'm like, you had major surgery. Just like relax, let your laundry pile up. Like, who cares about your dishwasher? You don't need to be taking your Christmas decorations down 5 days after
Right.
this major surgery. Just allow your body to rest. Obviously, I don't want them like laying on the couch for like a solid month and getting like blood clots and stuff, but just allowing yourself to like take naps and relax and like eat comforting food. Like, you don't have to like be some superhero after surgery.
Yeah.
Mhm.
And I think as women, that's one thing that we always feel like we just have to get right back at it.
Yeah.
And the house will fall apart without us. So,
Yeah,
yeah.
just hire a TaskRabbit to come in and do your laundry or have your good
I
friend
wish we
come
had
do
a
it.
TaskRabbit down in Archie or between Archie and Garden City. I would have so many people out to just clean my dang house. I have a tornado and
You do.
oh my gosh.
I saw his little
Heather called me on FaceTime last night and she got
his
to
little
witness some of the
tornado.
tornado.
Mhm.
He
Yeah.
is, he is rough.
He's a sweet boy.
All right. Well, I think anyone have any questions for her before we end this episode?
Do you ever encourage like before surgery, like if they're smokers, like they not smoke, and as far as their diet, try to maybe like eat better or well just for the healing process
Yeah,
and
good question. So, always good to be on a good skincare regimen,
Mhm.
right? Priming our skin is a big investment. Nicotine in general vasoconstricts. It makes your blood vessels smaller, and so that can inhibit some of the oxygen delivery to
Mhm.
different areas that are healing. I tell patients it's really just best for your general health to
Right.
quit completely. That everybody kind of falls on a spectrum in terms of their interest in that.
Mhm.
If marijuana is legal in a lot of states now, and so I tell them you should not be mixing marijuana with your pain medication or anesthesia.
Mhm.
So if people regularly take like THC gummies, I say absolutely not 24 hours before or after anesthesia, because that's how long it takes to kind of get out of your system. And then
Mhm.
if you're taking the pain meds, you cannot take anything else that may impair you,
True.
because I don't
Yeah.
want them like falling down their stairs
Right.
at home.
Mm-hmm.
Nutrition wise, making sure that they're eating a diet that's just like generally balanced with like protein, fat, nutrients, vitamins.
Mhm.
Every surgeon kind of has their own little mantra. I'm a minimalist when it comes to all these like extra supplements,
Mhm.
Mhm.
because the supplement industry really isn't regulated and you just have no clue what's actually in that bottle of
Right.
pills.
Right.
So I don't ask people to take arnica or anything like that, because
Mhm.
I fear that they may end up ingesting something that like interacts with their home antihypertensive medication or
Mhm.
So I just say, just don't take any of the antiplatelet agents like
Mhm.
aspirin, Aleve, Motrin,
Mhm.
ibuprofen for, a good period before and after surgery. And we go over all that like in significant detail. The other drug that we have to talk about now is these weight loss injection
Yes.
medications.
Yeah.
And this is something that's changed. It's also different depending on which surgeon you go to, but currently it's March 2025. The big anesthesia group, the American Academy of Anesthesia or whatever they're called, they recommend that for like really elective surgeries, and there's nothing more elective than a facelift,
Mhm.
patients should have that drug totally out of their system so that their stomach has a normal motility, like
Mhm.
normal speed.
Yep.
Because we don't want your stomach slow for the day of surgery because you have an increased risk of accidentally vomiting
Mhm.
Oh.
when you're
Mhm.
asleep and then aspirating where it gets into your lungs and it can cause like pretty horrific lung
Mhm.
injury. So currently we are asking our patients to hold their weight loss drugs for 4 weeks
Oh,
before surgery.
okay.
And then after surgery, I tell them it's best not to start it right away. Best to get off your pain medications and whatnot before you restart it. Because I have had a few patients that have restarted their weight loss drugs and they're on prescription pain medication. Both of those slow your gut.
Mhm.
When your gut
Mhm.
gets slowed, you're not moving things through, which
Mhm.
can just add to the discomfort during the recovery process.
Very true.
That was a really good question.
Mhm. Yeah.
Any other questions for her?
Oh,
No? Okay.
I don't know. She's covered so much.
I know.
I
There's
I
been
mean,
know.
so much
a lot of it are the
information these
questions
last
that my
2
clients have been
episodes.
asking,
Yeah.
and so I think that we've covered a lot.
Yeah. And I feel like,
But I know that I'll go
multiple
And I
back
feel
and
like
I'll
times.
we've
have 10
barely
more
touched the
questions.
I know. I
surface.
know.
I feel like there's gonna have to be some more of her
I
in the
know.
future.
Oh, of course.
Because we didn't talk
So
really too much like upper and lower bluff and all those things too, because, of course, they always
Those are
want a
the
brow
most
lift
popular
with
ones that
Botox and
we send for
yeah.
um, is there.
but we'll have to save those for another day.
Yep.
So I want to give Lauren a huge thank you for coming and hanging out, sharing all this knowledge. She shared so much. So if you didn't catch last week, you need to go back and listen to last week. Last week had so much more to it. Heather. Oh wait, hold on, Lauren. Where do we find you? Your social
So
medias.
it's Lauren Umstattd, MD. You can find me on TikTok, Instagram, Facebook, really all the
Or give
socials.
us a holler and we'll send you her way.
We've got her cards. We'll give you her card.
We have her on our banner outside our
Yeah.
window.
Yeah.
Yeah, we
got
did,
you.
but we just took that banner down, remember?
we
We haven't
did?
put up a new one
Oh,
yet.
Oh.
I
yeah.
do not pay close enough
You don't
attention.
play that happened
I know.
2 weeks ago.
I just know I was
But
on
we'll
there
get her back.
I
twice. I
missed
was like,
it.
oh.
Sorry. You're not on there anymore. My bad.
Banners need replaced. They get faded.
They were faded and
Heather, where do we find you?
So on Facebook, it's Midwest Aesthetics Injections by Heather. And then I'm on the Amazingly Ageless and Skin Babes Facebook, Instagram, TikTok, all the things.
Kristen?
Okay, we have our website, Amazingly Ageless Med Spa. We're Facebook, Instagram. We have the Skin Babes Facebook group, and all the other things that Jared has us on.
And then
The
you
Talk
can
Tick, yeah.
find our podcast, Apple Podcast, Amazon Podcast, Spotify, Audible, YouTube. We have our video up here on YouTube. Make sure you like, follow, subscribe on all those. Leave comments, ratings on whatever you're listening to. We
And
like to hear from
questions,
you.
yeah.
We want to hear what you want us to talk about. So leave us questions. You can even leave it in our Facebook group. I think we have a poll up for like what you want to listen to. And I think that's all we have for today. Bye.
Bye, guys.
Bye, guys.
Bye.